Here are 10 Puerto Rico Medical Board-style clinical vignettes, focused on lymphomas, each with 4 answer choices and detailed explanations. Vignette 1, Hodgkin lymphoma, HL. A 22-year-old man presents with a painless cervical lymph node enlargement and night sweats. A lymph node biopsy reveals Reed-Sternberg cells. What is the most likely diagnosis? A. Non-Hodgkin lymphoma. B. Hodgkin lymphoma. C. Burkitt lymphoma. D. Answer: Hodgkin lymphoma. Explanation: Hodgkin lymphoma is characterized by Reed-Sternberg cells, alloy nuclei. It presents with B symptoms, fever, night sweats, weight loss, and is associated with EBV. Vignette 2, Nodular Sclerosis Hodgkin lymphoma. A 27-year-old woman presents with a mediastinal mass and painless lymphadenopathy. Biopsy shows bands of fibrosis and lacunar Reed-Sternberg cells. What is the most likely subtype? A. Nodular sclerosis, Hodgkin lymphoma. B. Lymphocyte-rich Hodgkin lymphoma. C. Mixed cellularity Hodgkin lymphoma. D. Burkitt lymphoma. Answer: a nodular sclerosis Hodgkin lymphoma. Explanation: Nodular sclerosis is the most common subtype of Hodgkin lymphoma and has fibrous bands and lacunar cells. It often affects young women with mediastinal involvement. Vignette 3. Burkitt lymphoma, a 10-year-old boy from Africa, presents with a rapidly growing jaw mass. Biopsy shows a starry sky pattern. What genetic abnormality is associated with this condition? A. T814, CMIC. B. T-FuCL2. C. T1114, cyclin D1. D. T922, BCR-ABL. Answer: 18th. Explanation: Burkitt lymphoma is associated with EBV and CMIC overexpression, T814, causing rapid tumor growth. The starry sky appearance results from macrophages clearing apoptotic cells. Vignette 4. Diffuse large B-cell lymphoma, DLBC, 65-year-old man presents with rapidly enlarging lymph nodes and fever. Lymph node biopsy shows sheets of large B-cells. What is the most likely diagnosis? A. Hodgkin lymphoma. B. Diffuse large B-cell lymphoma. C. Follicular lymphoma. D. Mantle cell lymphoma. Answer: B. Diffuse large B-cell lymphoma. Explanation: DLBCL is the most common aggressive non-Hodgkin lymphoma. It presents with rapid lymph node enlargement and B symptoms. Treatment involves R-CHOP chemotherapy. Vignette 5, Follicular lymphoma. A 58-year-old woman presents with waxing and waning lymphadenopathy. Biopsy shows follicular B-cell proliferation with T14-18 translocation. What protein is overexpressed in this lymphoma? A. BCL2, B. CMICC, BCL6, D. CD5. Answer: A. BCL2. Follicular lymphoma is an indolent B-cell lymphoma with BCL2 overexpression, T14-18, leading to inhibited apoptosis. It has a waxing and waning course. Vignette 6, Mantle cell lymphoma. A 67-year-old man presents with generalized lymphadenopathy and splenomegaly. Biopsy reveals CD5 plus B cells and a T1114 translocation. What protein is overexpressed? A. BCL2, B. BCL6, C. cyclin D1, D. CD. Answer: C. cyclin D1. Explanation: Mantle cell lymphoma is an aggressive lymphoma with cyclin D1 overexpression T1114, promoting uncontrolled cell cycle progression. Vignette 7, Marginal zone lymphoma. A 53-year-old woman with chronic H. pylori infection develops a gastric malt lymphoma. What is the first-line treatment? A. Rituximab. B. Antibiotic therapy. C. Radiation. D. Chemotherapy. Answer: B. Antibiotic. The explanation: malt lymphoma, marginal zone lymphoma, is associated with chronic inflammation, often from H. pylori. Eradication of H. pylori with antibiotics can lead to lymphoma regression. Vignette 8, Adult T-cell leukemia lymphoma, ATLL. A 45-year-old man from the Caribbean presents with lytic bone lesions, hypercalcemia, and hepatosplenomegaly. He has HTLV1 infection. What is the most likely diagnosis? A. Multiple myeloma. B. Adult T-cell leukemia lymphoma, ATLL. C. Diffuse large B-cell lymphoma. D. Hodgkin lymphoma. Answer: B. Adult T-cell leukemia lymphoma. Explanation: ATLL is associated with HTLV1 infection, presents with lytic bone lesions, hypercalcemia, and hepatosplenomegaly, and is common in the Caribbean and Japan. Vignette 9, Sézary syndrome, cutaneous T-cell lymphoma. A 55-year-old man presents with generalized erythematous scaly skin lesions. A peripheral blood smear shows atypical CD4 plus T cells with cerebriform nuclei. What is the diagnosis? A. Sézary syndrome, B. Mycosis fungoides, C. Burkitt lymphoma, D. Hodgkin lymphoma. Answer: A. Sézary syndrome. Explanation: Sézary syndrome is a leukemic form of cutaneous T-cell lymphoma, mycosis fungoides, presenting with erythroderma and cerebriform nuclei on blood smear. Vignette 10, Waldenstrom macroglobulinemia. A 68-year-old man presents with fatigue, blurred vision, and headaches. Serum protein electrophoresis shows an IgM monoclonal spike. What complication is most concerning? A. Hyperviscosity syndrome, B. Tumor lysis syndrome, C. Bowel obstruction, D. Lytic bone lesions. Answer: A. Hyperviscosity syndrome. Explanation: Waldenstrom macroglobulinemia produces IgM, leading to hyperviscosity syndrome, which causes blurred vision, headaches, and Raynaud's phenomenon. Plasmapheresis is the first-line treatment. Hash a final thought.